If your healthcare providers have recommended range of motion exercises, the following will describe the steps you take to increase hip extension. The purpose of this activity is to increase motion and flexibility of the joint, to minimize the risk of tightening the muscles and tissues, also known as a contracture, to maximize the movements for functional tasks. Range of motion activities will cause discomfort for the person, but daily stretching is important to the person's recovery. Precautions for this activity. Any activity restrictions from the surgeon. Pain that is not typical for this person. Any active infections in the area. Monitor the person's tolerance and endurance for this activity. Discontinue if the person is not tolerating the activity. Items needed for this exercise. Clean, gloved hands. A bed or an appropriate supportive surface. Position the person lying on their side with their back close to the edge of the surface they are lying on. Approach the person from behind. You will be stretching whichever leg is on top. In this case, the right leg. Instruct the person to relax and let you move them. Place your right hand on the lower portion of the thigh, just above the kneecap, with the palm up and the leg resting in the crease of your elbow. Place your left hand against the lower portion of the person's back on the side that is facing up. Slowly pull the leg back towards you while creating counterforce in the opposite direction with the other hand to keep the person on their side. Once you attain the end of the stretch, hold the position for 30 to 60 seconds. Stop the stretch if the person is reporting pain that is abnormal to them. Once the stretch is over, slowly begin to move the leg back to its starting position. Repeat this stretch 3 to 5 times, holding 30 to 60 seconds each time. This material is offered solely for educational purposes. It does not replace the physical therapy prescribed by your physician. The information provided in this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Stop an exercise if it causes pain or discomfort. If pain or discomfort persists, seek medical attention.